you're here to finish your registration with the practice and have a little health check with me? Yes? Okay, just bear with me a second. I'll just bring up the details that I've got and we'll take it from there. You're doing well today? Good. I'm Nurse Sarah and I'm the senior practice nurse. And you can see me here for a variety of things, but I generally do the new registration checks. And then you'll be seeing a doctor another day. Okay, right, can you just confirm your name for me? Make sure I've got the right form, because you've completed the first part online, haven't you? Yeah. Okay, right, that's fine. And your date of birth, please. Yeah, good. Okay. Firstly, have you bought your 3 forms of ID for me? Yeah? Okay, that's great. If you could just pass those to me. Yeah? Okay. That's perfect. Let's see what you've got here for me. I'll just check the passport. They're never very flattering, are they? Oh, yours looks fine. I look really miserable on my passport. Okay, that's fine. And this is utility bill. I'll just check this. Okay, that matches up with your address. Okay, and there's this one. Okay, so these are just bank statements. Let me just check through. Yeah, we have to have 3 forms, and one of them does have to have your photo, but that was your passport, so that's fine. Okay. And these are all recent, so that's fine. Perfect. Thank you for that. Just pop these back in here. Okay. There's your passport. Okay. Super. Right. So you've completed the basic form. I do need to go through some healthcare questions with you, if that's okay, before we do any physical checks. All right, so let me just see what we've got here. You've completed that online, so that's fine. So I just need to ask you a few questions. Do you consent to share your medical record with other NHS organisations? Okay, that's fine. Do you consent to your full medical record being shared? Okay. Obviously, as a practice, we hold your information, but if you would need to be seen at a hospital, the systems are linked so they can access your medical records easily, which makes the whole process of treating you a lot quicker. Okay, and we do not sell any of your information to third-party organisations. Okay, so just a little bit of family history now. Has your birth mother, father, brother or sister had angina or a heart attack and were less than 60 years old? No? Okay. Perfect. Okay, that doesn't apply to you. So how tall are you? Okay. Do you know your current weight? Okay. Okay. Have you ever smoked, or do you smoke now? You used to. Okay. And how many did you smoke a day? Okay. 15. Okay. Are you a carer for a relative, friend or neighbour? No? Okay. Would you like to sign up for electronic prescriptions? So if you see a GP or a practitioner here, you can have your prescription sent straight over to our pharmacy. Yeah? Okay. And you can also have your repeat prescriptions done that way, that's fine. Okay. Your first language, English? Yes, okay. Okay. So you're not an international patient. So that's fine. Lovely. Okay, just a little question about alcohol consumption. How often do you drink alcohol? Okay. A week? Okay, once a week. Okay, that's fine. And how many units of alcohol do you drink on a typical day, or what do you drink? So it would be, right, okay. So 1 unit is a glass of wine. Yeah, small glass of wine. Okay, that's fine. Have you often had 6 or more units of alcohol in one session? Okay, maybe once a year. All right. Okay, that's fine. Right. I'm not going to bother with the next section because your alcohol consumption is really low, so I'm not concerned about that. Okay, so that's fine. Okay, so let's just double check we've got all the right things there. Right, okay. Right. So general health. You're coming to us from a different practice, aren't you? So we'll be bringing all those details from your other practice over anyway. You've had no recent operations? No? Okay, that's fine. And your current medications, let me just check what we've got down for you here. Okay. You're nice and easy. You only take a painkiller now and again, is that right? Yeah. Okay. And that's for migraine. All right. Fine. Right, we'll leave that there because that's all stored on our system now. Thank you for that. So, in order for us to get our own information, I need to give you just a little basic medical check. Obviously, I'm not a doctor, I am a nurse, so I can't do the full range of checks that a doctor could give you. I can't diagnose conditions either, but what I will do the basic checks, and I'll also take a blood sample from you today, if that's okay, and that will then go onto the system. All the results will be on the system for the doctor to see for when you see the doctor. Okay, you happy with that? Good. Okay, now you're okay with needles, aren't you? That's fine, I just wanted to check before I do that. Okay, so just give me a couple of moments, I'll get ready to do a few checks on you, okay? Okay, that's everything ready. just need to get my gloves on. Have you been enjoying the nice weather? Good. It's been great, hasn't it? About time we had some nice sunshine. Okay. These are nitrile gloves, so these will be fine for everybody. Do you have a latex allergy? No, okay. Well, I'm using these at the moment anyway because I find them more comfortable for me. Okay, first things first, I'm going to take your temperature, alright? So, just this device will beep by your ear, okay? Won't feel a thing, I promise. Okay, just stay very still for me. Nice and healthy there, that's good. Okay. Fine. Right, little blood pressure check. You've not had blood pressure problems before, have you? No. Okay, but you've had this done many times, I'm sure. Okay, so you know that it doesn't hurt, it just feels a little bit tight on your arm. Okay, so I'm just going to put the cuff around this arm, just outstretch your right arm for me, thank you. There we go. Let's inflate the cuff. That's all good. Okay. I'll just do the same on the left side. I like to take it on both just for comparison. So just give me that left arm. Thank you. Okay. You ready? Super healthy there with the blood pressure. Okay, I'll just make a note of that. Okay. So have you had any problems breathing in the past? No? No. So let me just pop this onto your chest. And just take a nice deep breath in for me. And out. Lovely. And in. And out. Great. And round here. And in. And out. Lovely. Just pop round the back. Okay. And in. And out. Lovely. And in. And out. Okay. Can you say 99? Good. 99. 99. 99. That's lovely. I'm just going to pop the stethoscope onto the pulse on your neck. Okay. There we go. That's your oxygen sats. You've probably seen one of these before, the pulse oximeter. Just pops onto your finger for a short time, okay? And it just checks the oxygen saturation in your blood and tells me your pulse as well. Okay, so I'll pop that on, finger on this side. There we go, thank you. There we go. Just keep that there for a short time. That's fine too. All nice and healthy there. Okay. Right. Your height and weight seemed fine. The calculation came out good for the BMI. Can I just take a waist measurement? Yeah. I've just got this tape measure. And I'll just go round. There we go. Let's just get that round there. And round the front. Okay. That looks like a healthy measurement, and you certainly don't appear to be carrying too much weight, so that's good. Do you enjoy exercise? What do you do? Okay, yes. I like walking too. Perfect. Okay. Right. I'm just going to have a little look in your eyes, if I may. Are you okay with lights in your eyes with your migraines? Okay. I'm just going to be looking just at your pupillary reaction for a short time. Tell me if you think it's feeling uncomfortable. All right, just look straight at my nose. Okay, lovely. Okay, just going to bring the light in there and there. Okay, does that feel okay for you? Good. And there. Okay, that's fine. And your eyes don't look puffy. Okay, well, while we're on the subject of eyes, behind me you can see the eye chart, this Snellen chart. I just want to do a very, very basic eye check, okay? So can you start to read from the top for me? Okay, and just see how far you can get down that list. Okay. Fabulous, okay. Alright, can you read that line there? Okay, can you just cover up your left eye for me and just have a read of that line there? Okay, alright, yeah. And can you read that line there? Good, okay. Now, can you cover up the other eye instead and do the same? Just read that for me there. Try a little bit lower down. That's fine. You can see better than I can. Alrighty. Perfect. Okay. Right. Well, while I've got my light, I'm just going to have a little look into your throat, if I may. Okay. Sometimes these are really difficult to get out of the packet, so I tend to just open it just before the patient gets here. Some people tend to leave them out of their packets, but I don't like to do that. I like to keep them nice in their packet, but I don't like to stand there for ages opening them. So, okay, make sure my light's on there. Lovely jubbly. Having problems with my light at the moment. It doesn't seem to want to work too well. There we go. Okay, let's just have a little look nice and wide for me. Okay. That's good. That's good. Lovely. Okay. I'm sure the doctor will have another look afterwards when he sees you as well. Okay. Right. Let me just have a little feel of the lymph nodes down your neck. Alright, just a slight gentle pressure, and I'll just be running my fingers down there. Okay. So just down your neck and under your jaw. Okay. Behind your ear, slightly. Okay, and just across your collarbone. Okay, that's all good. When was the last time you had a migraine? Okay. Right. Before I let you go, I need to just take a blood sample if that's okay. Right, bear with me. I'll get that ready and we'll be good to go. Right then. I think we're ready for this. Just going to cleanse the area. Okay. Do you have a preference? Okay. Well, I'll cleanse both arms and then we'll take a look from there. Okay. All right. Just do this side now. Let me just have a little look and see what I think might be the best arm. Just going to have a little pat on the arm just to see. I think this side. So I'm just going to pop this tourniquet around your arm. This will go a little bit tight and uncomfortable for a while, but it just brings the vein up so I can get your blood sample more easily. Okay. There we go. Nice and tight there. Just get the syringe ready. It's not a big needle, don't worry. Okay. So just make sure that's looking good. Yeah. Look away if you want to. You'll just see be a little sharp scratch. Yeah. Okay. Ready? Good. Okay, sharp scratch. Just about now. There we go. coming out nice and easily. I like patients like you. Okay. Let's take that tool in, okay? Okay, let's take that off. Super. Okay, I just need you to hold that and just press that down on there for me. There we go. Keep that there for a minute. I'll just sort this. We'll get this tested. It's a general blood count that the doctor likes to see. Okay. Just have a look at this now. Yep, you're all good. That's perfect. Okay. Now, I want you to take a urine sample bottle. So you can go home and do that, or if you need to go, you can go after you've had this appointment and just drop that in at reception. Okay, and we'll get that checked for you. There we go. Lovely. Okie dokie. Let's just double check I've done everything I need to do. These forms are new, and each time we do them they add something else onto them. But I think we're good to go. Right. Just double check your arm there. Right. Let's take my gloves off. You've checked out fine for me today. I'm just going to just double check everything and then send it over to the doctor's workbench so the doctor can pick that up. Alright, so let's just make sure that's all gone. Sometimes the systems can be really slow. I just have to make sure that everything's gone over, all the details. So that will be your registration complete. But there will be, as I say, an appointment made for you to come in and see the doctor later at some point. It might be within a couple of days, depends on when the blood tests come back and the availability. But the receptionist will call you. Okay. Let's wait for this final bit to go through. It's always the same, isn't it, when you've got a lot to do? There we go. All done. Right. Well, thank you for coming in today. I'm pleased to say that you're now registered with our practice and everything I've checked for you today is fine. Alright, so we'll be seeing you shortly when you come in to see the doctor. I'm sure you'll be seeing me again at some point. I do a lot of health checks and general things in the surgery. Okay, I also specialise in certain areas of nursing as well, so if you ever need any of those you will probably see me. Okay, but if you have any questions, just call and ask reception or you can pop in. They're really helpful and they've got lots of leaflets they can hand to you today as well on your way out. Okay, well, enjoy the rest of your day. It's lovely to meet you. Take care.